Hello, this is Lee. This is my office manager, Bob. Today
Hello.
we'd like to talk about vision. So we use our eyes all the time. Actually, we use them more because we're looking at iPhone, we're working in front of computer. So vision, healthy vision would be a big issue in the future for the younger generation. When we get older, the blood circulation to your brain, to your eyes, and are declining. Especially we're talking about low blood pressure. And you have any vision disturbance in the past?
Yeah, I've had on occasion, it's not, I couldn't say it's like once a week, once a month, but over the last maybe 3 years, I've noticed that I may be watching television and I have perfect vision in the center of the image that I'm looking at, but the outside of the image is very cloudy. So I noticed that that's blurry, and this might come on a little bit slowly. I could kind of feel it, and then I just kind of sit down and I try and relax and not worry about it. But I have found that if I take a full bottle, maybe 12 ounces, 16 ounces of water, it seems to go away, but it will leave me with a headache afterwards.
So the optic nerves need sufficient blood flow. When you are dehydrating, the optic nerve have not sufficient blood flow. So the blood vessel will constrict to try to get the blood flow going. In that sense, you drink water. That's one step. And the other quick step is you can lie down. Once you lie down, you don't have the gravity. Your blood flow to your brain, to your optic nerves, are instantaneously improved. And I remember when I was young, my father, who had severe low blood pressure, and periodically she would have severe migraine. She has to lie down, shut down the window and the curtains, and she would lie for a couple of hours, and then she overcome that migraine. I think by lying down, the blood vessel spasm relieved. But after retirement, he started drinking more water. I don't remember he ever had migraine. So I think your experiences with vision changes and dehydration, migraine, the headache, right? It's not really migraine, it's a headache. All related with your blood pressure, your blood vessel spasm.
Okay, I've had the water before that seems to help, but when you commented about lying down, I wouldn't do that. If I were watching television, in fact, I wouldn't even turn off the television. I would just drink the water and try and relax and give the water a chance to go through my system and hydrate myself, and the condition would go. It would leave me with a headache afterwards.
Yeah, the reason I recommend you lie down is because that's a faster relief. So if you lie down, the circulation to your eyes instantaneously improved. I have 93 years old when I needled one point on the hand because he was taking blood pressure medication. So his ability to adjust the blood pressure is decreasing. So once this needle going in, his blood pressure dropped, and then his speech changed, and he started sweating. As soon as he lied down, within a minute, his condition changed. He come back to consciousness, and he can talk normally. So the optic nerve are very vulnerable. So if you take longer time to get sufficient blood flow, you may gradually damage that, because you may not experience the big changes of vision, but the longer time you take to relieve this blurry in the peripheral vision, the more damage you make. Until one day you exhaust your reserve. We have reserve, we have so many nerves. Until you damage majority of the nerves, then your vision will be changed, and at that point it cannot be reversed. So that's why I follow up a couple of 106 years old. They were in good condition. They died without suffering. So they like to lie down, not necessarily fall asleep. Just lie down, and by just lying down, not necessarily fall asleep, your circulation to every single part of the body would improve. And not only that, your back muscle, your muscle around the joint, shoulder will be more relaxed and balanced. So when you get up, the tightness of the muscle around each joint will be relieved. So thinking about you get up early in the morning from 9 a.m. until 11 p.m. You're sitting, you're standing, all of this position would put pressure on your spine, making the muscle tight. And if you get 20 minutes once a day to rebalance muscles and bring the blood flow to the eyes, to your hand and the feet, you actually can prevent the vision declining, the neuropathy to your hand and the feet. Wouldn't that be a cheaper way?
Yes, and also, I never thought much of this condition because it's not an everyday occurrence. But now, after talking to you and realizing that if I've had these episodes for 5 years, and the collective total of all of the episodes could eventually lead into some damage to my eyesight, the best way for me to control it is make sure I do hydrate properly and I don't get dehydrated, and also control my blood pressure if both of those conditions are most likely the cause of what I'm explaining with the visual problems.
Yes, and I do have 100 years old lady who is still reading. Not everybody can keep their vision as sharp as she does, but she served in World War II. She is a very disciplined lady, and that's why she is in a relatively good condition. So we need to take care of our body, our mind. Thank you.
And our eyes.
Yes.